I'm Dr. Satvik Pai, an orthopedic surgeon practicing in Orthomed Center, Jayanagar, Bangalore. So today we are going to be talking about something that people face often, that is do's and don'ts of fracture care. So usually you might get an injury, either a small accident or maybe a fall at home, or maybe sometimes if you're playing some sports, you may get some injuries. So very commonly we see fractures, sometimes of the upper limb, sometimes of the lower limb, sometimes of the spine. Fractures are very common. So I'm just going to be telling you some basic do's and don'ts when you're facing this. So the first, coming to the do's, the first thing you should do is try to immobilize that area. What that means is you don't try to move that area that is affected. So if you feel like you might have injured your wrist, so what you should try to avoid is don't make too many movements. So you try to keep that wrist in that same position, in one fixed position. Now, if it is available, there will be certain splints that you may get. Some places, if it's a factory, if it's a school, they may have some first aid kits which will have some splints. So those can be used. Next, it would be that you can, if you're at home, you can try and put some ice pack application that will kind of decrease the swelling, decrease the pain a little bit. And the next and most important thing would be to seek medical care. So you should be seeking the advice of a doctor, ideally an orthopedic surgeon, who will then go ahead, do the X-ray, diagnose the fracture, and then treat it accordingly. Coming now to even more important than the do's is the don'ts. So some of the common things that people do wrong that can actually have devastating effects. The first thing would be to move that part. So trying to, think that you can just walk it off, try continuing to play or continuing to walk about, putting weight on that area, that should be avoided because that can even worsen the fracture. That's the first thing. The next thing would be you should avoid trying to realign it yourself. So if you feel there's a dislocation, there's a fracture, sometimes there's videos of it on social media, everything of people aligning it themselves, would not be recommendable at all because you might end up doing a lot more damage. You try to do such things, the fracture may displace more, you might end up causing damage to the blood vessels, all of it. So avoid trying to realign it yourself. And the other thing to avoid would be trying to apply anything in that area other than ice. So if especially if there is any open wound. So if there is an open wound, don't try to put any cream on it, don't try to put some other powder, nothing over those areas. So avoid these things to avoid even more damage happening, right? So these are just the general basic do's and don'ts, which is common for all the fractures. The most important thing is to immobilize it for a while and go directly to a medical professional and seek for that.